As a common saying goes, our mental health is just as important as physical health when it comes to overall wellness. And today there are numerous services that are devoted to mental illness and improvement of mental health in people with mental disorder and problems. Such is the Tibetan medical system, which is probably the world's oldest known medical traditions and integral part of Tibetan culture. So in today's conversation, let us learn about the mental health care in terms of Tibetan medicine, its root causes and treatment. And for that, we have invited Dr. Sonam Wangmo from Clinical Research Department under the Men-Tsee-Khang Tibetan Medical and Astro Institute based in Dharamshala. Welcome to our program, Amjila.
Thank you. Thank you for having me.
It's so good to have you here on our program. Can I ask you, from Tibetan medicine point of view, how is mental health care viewed and what are the primary causes of its disruptions?
Tibetan medicine is also known as Sarika, is a very vast and profound and extensive knowledge, system of knowledge, and integrated with many core of Buddhist principles and astrological aspects. So the Sovarikpa is a holistic approach which recognized mind and body as interdependent. So when you talk about the mental health, as per the Sovarikpa, the Tibetan medicine, we talk about the mind. Before learning about the mental health, we should learn about what is mind, the concept of mind. So the mind itself is a luminous, clear, and all the senses that we perceive through our five sense of organs, it's all because of the functioning of the mind itself. So in Tibetan medicines, mind and body are the interdependent and cannot be separated. And as the saying goes, the healthy body, healthy minds. So these both are closely linked and interdependent. And so when we talk about the mental health in Tibetan medicine, so we speak about the imbalances of the lung energy. So the lung energy in general and Sokjin lung or the life-sustaining lung in specifically. So when the imbalances or the disruptions happens in the Sokjin lungs, then it causes all the sorts of the mental illnesses. Yeah.
So lung basically translates to air?
Yes, the lung, when we talk about the lung, it means the air element or the energies. So lung energy is one of the principal energy that helps us to sustain our body and to help us to lead a healthy body. So lung, it's formed from a air element, and all the functioning and the activities of the body and the mental activities are done with the help of the lung energy. So there are 5 different kind of lung energy, and it has their own functioning in our body. So lung is the one which acts as a medium between our mind and our body.
So in modern context, if a person is not feeling well, or suppose he's there's mental illness or the disorder or the problem that a person is going through. So as a Tibetan medicine practitioner, how do you diagnose the patient?
So whenever an individuals or the patient come to us for seek help with the mental health, we look it in a greater perspective of lung imbalance. So there are the concept of the managing mental health care in Tibetan medicine mostly deal with to manage to sort out the root cause rather than to go for a symptomatic treatment. And the treatment for the mental health care or the management of mental health care are of various therapeutic approaches like diet and lifestyle interventions as the first priority, and then the herbal pills and the external therapy interventions, which is very effective for the to manage the mental health care. And then we have the spiritual interventions and astrological aspects as well.
So, Amjila, I'd like to ask, what are the common root causes of the general mental illness or disorders?
So when it comes to the the prevention of either the physical or the psychological disorder, we must learn about the root cause. So the root cause of all the sufferings is the ignorance, which is a self-grasping, or the ego, or the self-centered. So which in which it gives rises to the three mental poisons or the defilements, or we call it the nyomong tuksum, decha shedan timuk, the attachment, anger, or hatred, or the delusion mind. So as a result of these three mental defilements or the three mental poisons, it gives rises to the three nyepa, or the lung, tipa, bekin. So that's how the disease or the imbalances arises as per the Tibetan medicine. Yeah.
In modern and conventional medicine, treatments often includes a combination of medications, therapies, and counseling for mental health. So, does the Tibetan medical system offer a similar approach of addressing these mental health issues?
Absolutely, yeah. We have, like as I mentioned earlier, we have the four major therapeutic approaches: diet, lifestyle, herbal, the medicine, and then the external therapies, and the spiritual helps, and the astrological aspects as well. So, whenever the patient come to us to see us and they seek help, we first we find out the root cause. What is the thing that is causing him the mental illnesses or the imbalances of the lung? So accordingly, we treat the patient, and most of the patient, whenever the patient comes, we always first our first priority is to calm him down. So let's say if the patient with the mental illness come to you to seek help, and when you give counseling, no matter what, he won't listen to you because of his agitated mind, right? So the first thing is to calm him down. So for that, we apply the calm or the warm massage oil to soothe him, and once his mental state calm down, or to come to the grounded level, then we prescribe medications to balance the lung energy. And there are certain points which are very effective to calm down and to channelize the lung energy in your body, which will help you to sustain or to enhance a good sleep, the muscle relaxation, and to promote a better breathing by clarify the airways, and also with the heavy breathing, etc. Yeah.
I want to bring this attention on the term the depression, on depression, because in this modern time and age, it is also said that the term depression began to emerge in the late 19th and 20th century. So, how does the or has the understanding of depression emerged and evolved in Tibetan medicine? Because from depression, whether it's from your work or whether it's from your something is not going right in your life, these also led to different mental health issues, right? How has the Tibetan medicine evolved to understand this?
So as the modern medicines, there are they have many kinds of like the mental health or disorders or the mental illnesses like depression, anxiety, bipolar, ADHD, and so on. But in Tibetan medicine, we viewed it as the imbalance of the lung. So It's already there in our text, the four Tantra text, which is more than of 2,500 years old system. So the modern day individuals, like, because of the diet, lifestyle. Again, here your diet and lifestyle plays a very important role in maintaining your good mental hygiene or the mental well-being, right? So because of the hectic lifestyles and that you don't get enough time for your self-care, for taking care of yourself, and because of that you tend to take the fast food. You are not getting enough sleep, over use of the your sensory, like, overindulgence in the screen time, right? The lack of sleep, and also surrounding yourself with the toxic relation, like, the environment, and the external environments, pollution. These There are so many factors that also contributes for the mental health as well. Yeah.
And does therapy work in Tibetan medicine?
Yes, the therapies, the external therapies in the Tibetan medicine, it works a wonder for those who have the lung imbalances. So, recently we have done a clinical research trial on the generalized anxiety disorders, and on that research, it shows that the external therapies among the intervention group shows a very significant result. Having the Tibetan medicine along with the external therapies. So yes, it proves that those with the generalized anxiety disorders can take it is safe and can take the external therapies along with the Tibetan medicines to improve the quality of life. Yeah.
And what exactly does external therapy include?
Yeah, so there are like different kinds of external therapies, like massage, hot water fermentation, horme, which is also known as tsati thupa, and to apply all those the medicated oil on the certain points of your the lung points, and also counseling. So these are the external therapies which we have applied during the studies, and it shows a very good result.
And Angela, over the years of your practice and through your research under the your clinical research department in Men-Tsee-Khang, what do you find the most common mental health illness or problem in our community?
So one of the most common the mental health disorders is the generalized anxiety disorders, which we also known as the GAD, and the second is the depression and the anxiety, and also this one mood disorder, which is mainly among the women. And these days you can also see quite a good number of women having postpartum depression, and some few numbers of the PTSD as well. Yeah.
And how has your perception of on mental health has changed over the years while treating these patients and learning about them?
Now the exposure and the information among the general public has also become more aware about the taking care of their mental well-being, and I have seen like the peoples are more vocal or more open up about sharing and coming to the to the clinics, or to take help from the profession to get rid of their mental illnesses. And as as emotional as physical health gives health and happiness to our body, so emotional health is also very important, and it also gives health and happiness to our mind. So therefore it is a very integral part of our health, and everybody should be more or open up, or more give more attention to our mental well-being. So the mental well-being is also important equally as the physical health, So as His Holiness always says that, he emphasized on the emotional hygiene. So to encourage us to, get rid of the anger, frustration, because these are the negative emotions, which clouds our mind. So therefore, we must wash them away, and everybody should seek a little bit of mental scrub for self, and self-love, self-care, and taking time for yourself. So these are very important, activities in our day-to-day life. Under the our department, so we have a mental health department. So until now, we have the mental health department has organized 12 conferences on the healthy body, healthy mind, and also from the past few years, there have been like actively working on bringing the awareness about the mental health in different settlement and also in the schools as well. With this, I want to conclude with the phrase from His Holiness the Dalai Lama: mental health is more important than the physical health, as it helps to tame our mind, and the mind helps to tame our body. Thank you.
So, Amjala, these are my questions for this conversation. Thank you so much for taking out your time to talk to us about this very important topic, mental health care. And it was lovely having you here. Thank you so much.
Thank you.
With this, we have come to the end of today's program of In Conversation with Tibet TV. Thank you so much for watching.